I've always lived in Brighton. I'm actually a mature student, 42 years old. Hi, I'm Tess. I'm a third year mental health nursing student at the University of Brighton. So I decided to do mental health nursing because I felt that's where most of my skills are. I've worked with older people with dementia, schizophrenia, mental health hospital just to get some experience, and I thought, yeah, this is definitely what I would like to go into. The application process was relatively easy. I did it online through UCAS, and then I got an interview very quickly. In the first year, it's the foundation course, so you're with the adult nurses and also the child nurses as well. Also exams on anatomy and physiology, but to be honest with you, it may sound really daunting, but it really isn't. It's really interesting, and it's probably one of my favourite parts of the course in the first year. The second year, you start to sort of specialise more in your chosen subject. So for me, it was mental health nursing, looking at things like human qualities and values, and looking at the way that we can make assumptions about people, but looking at the bigger picture at the same time. So I found that really, really helpful. And now I'm in my third year. One of the modules I've found really interesting is leadership. I would say that's my favourite module of the course. And at first, I was a little bit wary of it, thinking leadership, I don't even know if I want to be a leader. I may just want to be a Band 5 nurse, but when you start the module, you can have sort of a negative impression of it. However, towards the end of it, I thought actually this is really, really helpful because all nurses need to be leaders. Whether you want to be a charge nurse or whether you want to stay at Band 5, essentially you are a leader. You are an advocate for the patient, so you do need to have some leadership skills. So I found that really, really interesting. I've had the opportunity to have a variety of placements in a male acute ward, female acute ward, older people with dementia, older people with mental health issues, and also community and a drug and alcohol placement as well. So I've literally had a whole spectrum. I've always lived in Brighton. I think it is, without a doubt, the best place to live in the UK. So I feel very, very privileged to live here. There's something for everybody. It's very cultural, it's very diverse, it's got a great nightlife. As I said, I'm a mature student, I'm 42, so I was a little bit daunted coming in and thinking, am I going to be like the oldest one here? Who am I going to talk to, etc. But what I found was that there's, on all the courses, whether you're doing mental health nursing, child nursing, or whether you choose to do adult, the age range is really wide. You've got people in their early 20s and then also people in their 40s, 50s doing the course, and everyone gets on fine, there's no problem at all. I think I've definitely become more reflective since my first year. I feel kind of like a more rounded person. I feel that the university has helped me sort of grow and develop and become more critical. So as I said before, not looking at just sort of things black and white, looking at grey areas as well. I've decided that I'd like to work with older people with dementia. I had a preconceived idea that that was what I wanted to do before I started the course, and I kind of thought, well, maybe I want to try working with women or with men, but I've kind of come full circle and thought actually dementia is definitely my passion. So I've got a job at the end of the course already in a dementia ward, so I'm really looking forward to that. My top tip would be to not get overwhelmed with assignments. and to really work on time management. I think that's really important. I can easily get very, very stressed if I've got a lot of deadlines. So my way of sort of controlling that is to get my assignments done quickly. I feel really lucky to be part of the University of Brighton community. I wouldn't have chosen to go anywhere else, and I've really, really enjoyed the course, and I really recommend it. If you're thinking about it, you know, we need good nurses. You're never too old. Don't think, oh, maybe I can't do this, maybe, you know, maybe it's too late. It's never too late. And I would just definitely say, if you are thinking about applying to the course, go ahead, because you never ever know what's in store.